Another important aspect of the documentation for ACMED patients or really work-related injuries in this case is going to be the return to work note. So anybody who comes in and it's clear that they're coming in because of something that they believe happened at work or surfaced at work, even if you feel right off the bat like this is not work-related by the definitions that we talked about earlier, they're going to need some documentation from you to go back to work. So just assume that you're going to be writing them a work note. Even if that work note just says return to work with no restrictions, most HR offices in a company or the ACMED office in a company, they're not going to let people come back without a note of clearance or a note of restrictions.
And oftentimes they'll actually send you with that form, right? Which is actually my flag is like, oh, this is a occupational thing. And so it's kind of my trigger. There's this whole form that you have to fill out. You're like, I can't go back to work without this.
Absolutely. And so in those cases, it's easy because you get the form and you know what to fill out. But if you're thinking of the patient, you can go back to work, it's fine. You're still going to have to write them a note that says you can return to work without restrictions. Don't hold that against your patient. That's the expectation of their workplace. So just write them a note that says return with no restrictions. On the other hand, if you feel like they are going to need restrictions, which is quite common, typically if somebody's being sent in or comes in to you with a concern for a work-related illness or injury, it's because they couldn't do all of their work duties properly. And therefore, the chances that they're just going to be able to go back after your evaluation and do their work duties with no restrictions is pretty slim. So you're probably going to be writing them some kind of work note. And this is something that gives providers a lot of anxiety. Like, oh, even after I'm done with the visit, now I've got to do this whole form about their work note. I'm going to talk to you about how to do this a lot more easily. So this is the dreaded form or some version of this form. You will see this in a lot of cases either brought in by the employee who's coming in from their employer, sending them with this document to be completed by you. This is a little bit what a standard 827 form is. That's the workers' comp documentation. Or this may just be the generic form that you have in your clinic that you're expected to fill out if somebody doesn't come in with their own paperwork. Typically, at the top, you're going to have just demographic information and injury-specific related information like what's the patient's name, what's your name, when did the injury occur, how long have you been seeing them for this injury. Ideally, you've completed most of this information in your note, so this should be something even that your MA can fill out for you in an ideal situation. But then you get to the part that makes people feel a little bit nervous and actually a little bit frustrated, and that is the checkbox section of the form, which is usually somewhere near the middle or the bottom of all of these forms. They usually contain somewhere between 200 and 8,000 checkboxes for you to fill out.
Yeah, and some of them are like crazy, like that can lift how many pounds. I'm like, I don't know if it's 2, 3, 5. Like it seems very arbitrary to me.
And how many inches and for how many minutes, each hour on Wednesdays. I mean, they get incredibly specific sometimes depending on who the employer is or just whichever form you're using. So the way that I have dealt with this for many, many years of doing this kind of work, and I've never had one of these forms get kicked back to me by an employee or an employer, is I completely ignore all of those boxes. I don't check any of those boxes under almost any circumstances because I have yet to see one of these forms that didn't have a line at the bottom that says something like additional comments or other, and then there's a blank line next to it. I fill in that line with what I believe to be the patient's restrictions, and I usually come up with that information by asking the patient, based on this injury, what can't you do at work that you would normally be expected to do? And then you'll find the patient will tell you very specifically, oh, I injured my hand and I'm a cook and I can't chop with my left hand. So what I write in the line is no use of left hand. And then the timeline is usually when their follow-up appointment is going to be, which is usually in 1 week for typical work-related injury. So no use of left hand for 1 week. And that's all. That should encompass everything that could put the patient at risk of worsening their injury. Similarly, if there's somebody who has injured their ankle and they have to walk around a warehouse at work and they say, I end up walking a mile or two at work, I can't walk with this. In that case, I'll either say no walking, or you can be a little more specific and say must wear boot and use crutches at all times.
All right.
People can get around an office building on a boot and crutches, but they can't do any work with their hands in that case. So that would limit them from things like warehouse work. So just use your common sense. Either put in the specific thing that they tell you that they can't do, as long as it sounds reasonable to you. If this is somebody with a sprained ankle and they tell you, well, I do keyboard entry and I can't type with my sprained ankle, you might say, well, I can't see how those two things are linked. Is there anything that your foot might be involved in?
You could just write no typing with left foot. and then they can
Typing
figure
right
out
foot
the
only,
rest.
which
Yeah.
really makes it easy. But so, yeah, I mean, as long as what they're telling you seems reasonably associated with their type of injury, then just go ahead and write it in that additional comments line. That should have them covered. It should give their employer the information that they need. Avoid giving time off work, which a lot of patients will push and advocate for. I'm okay with giving patients the day off when they came into the clinic, oftentimes because they're in pain or they've already missed a bunch of their day or whatever. But I tell patients, I can't tell you how long you need off work from this. I can only tell you what you can't do at work. We'll put that on the restrictions. You take this into work tomorrow. If they can't use you there with this restriction, then that's really their decision, not yours or mine.
Oh, that's good to know, because I think that's one of those things where people get a little nervous. They're like, well, I don't know how many days you can't go to work. It's like, well, don't even worry about that. Just put your restrictions. Like you said, they'll figure out whether or not you can be at work or not.
Yeah, so let's talk about a couple specific examples of what common sense advice might be for a patient. I really like this one at the top, and you'll see this a lot. You get the patient who's got a back sprain, and they say, well, if I sit for too long, it hurts, and if I stand for too long, it hurts, and I need to get up and down, and they don't let me do that at work.
It sounds like a prison they're living in. They're like,
Well, for some of them, they are, right? So, yeah, I mean, so you can just write down sit or stand at will in the comments box. If you try to fit that into the check boxes that are available, it becomes kind of impossible. You're too hemmed in and it's too specific. But sit or stand at will. And if their employer decides that that's not acceptable in our workplace, well, then that's the employer's decision, not yours or the patient's. If the patient says, I can't stand up at all and everything in my workplace requires standing, then you can say seated work only. You can put no use of right or left arm. If it's somebody who typically works in a wet environment and they've got a laceration, you can put keep wound clean and dry. Or must wear brace or crutches or sling at all times. Often if I've put any kind of a device on the patient and that device is what will restrict them from working, then I just put in must wear left arm sling at all times. That really means effectively that they can't use their left arm. It's common sense. Nobody can argue with that restriction, and then the employer can work with that.
yeah, the ball's back in their court in terms of actually limiting the work stuff, which we probably have no idea like how to do that in terms of what their work environment is. So I like that.